LASIK was always something I'd heard about, and to me it was kind of this foreign concept of this really expensive procedure that wasn't ever going to be available for me. So as a 27-year-old teacher, money is always something that's sort of that we're cognizant of, right? We're thinking about. And when I heard about how much LASIK was and really compared that to how much doctor's visits and contacts and contact lenses and glasses would be for the rest of my life, it really just made sense to get LASIK now. So it really surprised me hearing just how easy the procedure was, knowing that they're going to take the time to really measure and customize this procedure to myself and to make sure that I'm comfortable and explain the steps all along the way so that I know exactly what's coming.
We're taking a map of the surface of the eye, and that's one of the lenses that focuses light. And so we're looking to make sure that the cornea is not only healthy, but how we're going to reshape that cornea to focus light better.
I know.
It's been great that they've sent out videos and kind of keyed me in as to what to expect, and I know that they'll be with me every step of the way throughout the process, and at the end of the day, it'll be a really quick procedure. I feel incredible. Like, I have no pain, no discomfort, and I woke up being able to see, which is really cool. So the first thing I did was open the window, and I could see like all of the leaves on the trees, which is pretty amazing. So I'm really excited.
We'll hear more from Marie in a moment, but her story is one of hundreds of thousands that were candidates for this advancement in LASIK called Contura.
I didn't know that there were a multitude of LASIK procedures. I just knew based on some experience that I had working with the military that there was LASIK and that there was PRK. They did explain to me that based on my use case and based on what I was seeking, that Contura would probably be the best option.
I know Contura was what they recommended for me, given like my age and like my eyesight. And I know it's like specifically designed for my eyes, and they took like a lot of different prints and scans of my eyes. I decided that it's like my eyes, and I don't want to mess around with that.
Whether it's clarity to help you in the classroom, reading a book, on your bike, running, or driving at night, the procedure these patients and others rave about is different technically because of the additional scans on your cornea reveal something called higher-order aberrations, or little errors on the cornea. Now they are potentially correctable with Contura. For me, it was those halos from the streetlights and oncoming high beams that created problems when I drove at night. Not anymore.
Now, since having worked with Contura for a few years as a practitioner and having undergone LASIK with Contura myself, I can actually speak to having those higher order aberrations corrected. And then what my vision is like now is what I would expect it to be. I feel like I can see everything that I need to at a clearer resolution than when I was wearing spherical contact lenses.
I used to like not be able to really drive at night because of the glare and because of not being able to see far and stuff. So being able to drive at night with no problems, being able to read signs from like way far ahead, it's been amazing. So now I feel like I can like do anything. I can go anywhere at any time. It's great.
Next, a closer look at what's ahead on your surgery day and why patients say the procedure essentially pays for itself.